Welcome to this educational program. This module provides an introduction to erectile dysfunction, or ED. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. This material is independently produced, and the mention of any drug or medical product does not imply its endorsement. Erectile dysfunction, or ED, is a common problem, and in past years many men suffered with it in silence. If you are experiencing ED, the fact that you are viewing this presentation is a positive step towards improving your situation. While it is true that ED does become more common as we age, it should not be thought of as an inevitable part of the aging process. Many men enjoy full sexual function well into their later years. It is important also to understand that most cases of ED are related to medical conditions, and it is certainly not always a psychological problem. Finally, please understand that good treatments exist for ED, and most men experiencing this condition can expect improvements. Please take your time to review this module closely, and feel free to view it as many times as you like. Other modules on specific situations and treatments are also available. Simply put, erectile dysfunction is the inability to get or maintain an erection sufficient enough for intercourse. It is also commonly referred to as ED, erectile difficulties, or impotence. ED may or may not be associated with other types of sexual dysfunction, such as problems with orgasm, problems with ejaculation, reduced sex drive, or libido, or infertility. ED can range in severity among individuals. For some, it may be just inconsistent erections. For others, erections that are too soft to penetrate for intercourse. Others may experience early loss of erections, while still others may achieve no erection at all. It is difficult to know for certain just how common ED really is. It is estimated that 15 to 30 million American men suffer from ED. The chance of experiencing problems increases with age. About 5 to 20% of 40-year-olds complain of ED, compared to about 50% of men aged 50 to 90. If you are in your 40s, your risk of erectile dysfunction is 40%. If you are in your 50s, your risk of erectile dysfunction is about 50%, and so on. The penis contains two chambers called the corpora cavernosa, or erectile bodies, which run along the length of the penis and attach to the pelvic bones. Between the two corpora cavernosa runs the corpus spongiosum, containing the urine channel called the urethra. The corpora cavernosa contains spongy tissue made up of smooth muscle, fibrous tissues, veins, and arteries. Spaces called sinusoids within this tissue can fill up with blood during erection and expand the corpora dramatically. The expansion of the corpora compresses the veins in the penis, preventing leakage of blood. All of this tissue is surrounded by a fibrous coating called the tunica albuginea. Erection begins with physical or mental stimulation, or both. Impulses from the brain and local nerves cause the muscles of the corpora cavernosa to relax, allowing blood to flow in and fill the sinusoid spaces. The penis expands as it fills with blood. The tunica albuginea helps trap the blood in the corpora cavernosa, maintaining the erection. Erection is reversed when muscles in the penis contract to stop the inflow of blood and open outflow channels. Interruption of any of these essential steps in the erection process can cause ED. This includes loss of stimulation to start the process, poor nerve transmission of the stimulation to the brain and back to the penis, poor blood flow into the penis, hardening of the penile tissues, or an inability to contain the blood within the penis. Causes of ED can be divided into psychological causes and physical, also called organic or medical causes. At least 80% of men experience ED due to physical causes. Psychological causes include mental illness, especially depression, stress and anxiety, performance anxiety, fear of failure, guilt, relationship problems, and loss of attraction to one's partner. As mentioned, the vast majority of ED has a physical or medical cause. Some of these are controllable, while others, such as age, are not. Age, family history, high blood pressure, smoking, obesity, and sedentary lifestyle can contribute to hardening of the penile tissues and/or the small blood vessels called atherosclerosis. This leads to reduced blood flow into the penis and less ability to expand the penile tissue and contain the blood. Diet, lifestyle, and smoking habits are all controllable factors that can be adjusted to reduce the risk of ED. Long-standing medical conditions are the most common cause of ED. As mentioned in the previous slide, atherosclerosis and vascular disease cause reduced blood flow to the penis. Diabetes can cause ED in several ways. It reduces sensation of the penis and nerve transmission to and from the penis, and it contributes to atherosclerosis. 30 to 50% of men with diabetes experience erectile dysfunction. Kidney disease, chronic alcoholism, multiple sclerosis, and neurologic disease can also cause ED. It is an unfortunate fact that not only certain conditions, but also their treatments can cause ED. This is particularly true for high blood pressure and depression. Other drugs that can cause ED include antihistamines, tranquilizers, appetite suppressants, and cimetidine, which is an ulcer drug. Reduced levels of the male hormone testosterone from aging and certain conditions can result in ED, as can changes to the levels of thyroid hormone. Diabetes and kidney disease can also affect hormone balance, contributing to erectile difficulties. Surgery and radiation to the penis, prostate, bladder, rectum, or spinal cord can lead to erectile dysfunction. In particular, prostate cancer treatment, which is quite common, can often contribute to problems. This is because nerves that go to the penis are immediately next to the prostate. Trauma to the penis, prostate, bladder, rectum, or spinal cord can also lead to erectile dysfunction. Most importantly, this includes pelvic fractures and long-distance cycling, which can damage the nerves and arteries to the penis. In the past, ED was treated mostly by urologists, surgeons who specialize in the genitourinary tract. However, it is now common for ED to be treated, at least initially, by family doctors, internal medicine specialists, especially endocrinologists, and psychiatrists. Evaluation of erectile dysfunction begins with a full medical history, followed by a physical examination and lab tests. Depending on the situation, certain other special tests or a psychological assessment may be necessary. A medical history to evaluate ED includes very specific questions about the quality of erections, and a full sexual history including questions about sex drive, orgasm, ejaculation, and relationship issues. You may be asked to complete certain questionnaires, such as the International Index of Erectile Function, or IIEF. These questionnaires help your doctor to understand the nature and severity of your situation and to follow the effects of treatment. Try to be open and honest in answering questions about your sexual function, and don't be embarrassed. Other medical conditions and your medications will also be explored, as these will often be contributing to or causing the problem. A general medical examination will be performed, including assessment of blood pressure and pulses. The genitalia will be examined, and a rectal exam will be performed to assess the prostate and certain nervous reflexes. A more detailed neurological exam will be required in certain situations. Laboratory tests, which examine multiple organ systems, can be very helpful in determining the cause of ED. These may include tests for diabetes, a lipid or cholesterol profile, and measurement of hormone levels, especially testosterone. A prostate blood test, called PSA, is also commonly ordered for men over the age of 50. A psychological assessment will be appropriate for some patients. These will usually consist of a series of interviews with and without your partner, with a sexual therapist, psychologist, or psychiatrist. Questionnaires may also be used. As mentioned, ED can be treated at any age, and many treatment options exist. The best treatment varies depending on a person's situation, and your doctor will use all the information at hand to choose the best treatment for you. Treatment options include lifestyle changes, adjusting medications, psychotherapy such as counseling and behavior modification, oral medications or pills, topical medications such as creams and gels, vacuum devices, injection of medication into the penis, and surgery, including penile implants. These treatments are briefly introduced in the next slides, and many are reviewed in more detail in separate modules. All patients should strive to introduce lifestyle changes which may improve the quality of their erections and other aspects of their sexual function. These include smoking cessation, an exercise program that emphasizes cardiovascular conditioning, improving dietary habits, and weight loss. Diet and exercise are the only things that have been shown to possibly reverse erectile dysfunction. Finally, couples should take time to focus on their relationship and make changes where necessary. Beyond lifestyle changes, oral medications, or pills, have become the mainstay of initial treatment for ED. 3 medications now dominate the market for ED treatment: sildenafil, or Viagra, vardenafil, Levitra, and tadalafil, or Cialis. All 3 of these fall within a class of drugs called PDE5 inhibitors, as they block an enzyme in the penis called phosphodiesterase 5 to improve blood flow to erectile tissue. These pills, as a general rule, are highly effective, well tolerated, and the most convenient treatment for most men. However, they are certainly not for everyone. They can have some side effects, and they absolutely must not be taken by men who have heart disease and may need nitroglycerin at some time. Oral testosterone can improve erections in some men with low levels of this male hormone. Testosterone does not help if your testosterone levels are normal. Replacing testosterone may improve erections, but may not restore them completely. Testosterone mostly has an effect on sexual desire. Failing oral medications, there are some that can be applied topically and rubbed into the penile tissues. The most commonly used is called Muse, or medical urethral suppository for erection, which contains the drug prostaglandin, or alprostadil. This is sold as a pellet that is applied into the tip of the urethra, then rubbed in. In many men, Muse does provide an erection within 10 minutes that may last 30 to 60 minutes. Unfortunately, it may cause discomfort or burning in the penis, urethra, or testicles in 20% of men, and it is relatively expensive. Mechanical vacuum devices, also called vacuum constriction devices, or VCDs, create an erection by drawing blood into the penis, engorging and expanding it. Once the blood has been drawn in, a constriction ring is placed around the base of the penis to keep it in. As the figure shows, the devices have 3 components: a plastic cylinder into which the penis is placed, a pump which draws air out of the cylinder, and an elastic band which is placed around the base of the penis to maintain the erection. Vacuum devices have the advantages of working well regardless of the underlying cause of ED, avoiding the use of any medications and their associated potential side effects, and the minimal ongoing expenses once the device is purchased. On the downside, the devices are somewhat cumbersome to use for some and require manual dexterity. They are expensive to purchase initially. They also produce a less natural-looking erection, as everything on the inner side of the constriction band is soft, so the penis tends to be floppy. Several drugs, particularly papaver hydrochloride, phentolamine, and prostaglandin, or alprostadil, can be injected directly into the penile tissue. Alprostadil is marketed on its own as Caverject. Commonly, all 3 medications are mixed together in varying strengths into a product called Trimix. These drugs work to directly increase blood flow into the erectile bodies of the penis. These medications are extremely effective, fast-acting, and create a normal-looking erection. Again, they may be cumbersome for some and do require manual dexterity and training to learn the technical skill of injecting. The major potential risks of these medications are priapism, which is an abnormally long-lasting erection, and scar tissue formation in the erectile tissue. Use of these drugs is discussed in detail in a separate module. There are two types of surgery available for some men with erectile dysfunction. A very few men may be candidates for surgery to reconstruct the arteries or veins of the penis, while others may be candidates for a penile implant when all else fails. Surgery to the veins has not been shown to be very effective. Reconstructive vascular surgery is reserved for the very few men who have certain very specific abnormalities of the blood vessels of the penis or pelvis. It is performed by very few specialized surgeons, and the results are highly variable depending on the situation. Penile implants are a last resort in some men, when other options are not suitable or have not been effective. There are several types of implants, and these are discussed in more detail in a separate module. Again, this is specialized surgery done by urologists with an interest in this field. Results can be quite good. One must understand that there is no going back from this surgery, as the existing erectile tissue is damaged in the process of placing the implant. Also, there are certain risks to be aware of, such as infection, extrusion, and failure of the device. In summary, erectile dysfunction, or ED, is a repeated inability to get or maintain an erection. It is very common, occurring in up to 1/3 of men 50 to 90 years old. It is usually caused by a medical problem. Successful treatments for ED do exist, regardless of age or cause, and your doctor will help determine the best treatment for you. This slide lists some of the many resources available where you can find more information about erectile dysfunction. These references were also used to assist in preparing this presentation. We sincerely hope that this module has furthered your understanding of erectile dysfunction. We wish you the best for the future, and thank you once again for viewing this educational program. Is the inability to get or maintain an erection sufficient enough for intercourse? It is also commonly referred to as ED, erectile difficulties, or impotence. ED may or may not be associated with other types of sexual dysfunction, such as problems with orgasm, problems with ejaculation, reduced sex drive, or libido, or infertility. ED Welcome to this educational program. This module provides an introduction to erectile dysfunction, or ED. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. This material is independently produced, and the mention of any drug or medical product does not imply it's important also to understand that most cases of ED are related to medical conditions, and it is certainly not always a psychological problem. Finally, please understand that good treatments exist for ED, and most men experiencing this condition can expect improvements. Please take your time to review this module closely, and feel free to view it as many times as you like. Other modules on specific situations and treatments are also available. Simply put, erectile dysfunction endorsement. Erectile dysfunction, or ED, is a common problem, and in past years, many men suffered with it in silence. If you are experiencing ED, the fact that you are viewing this presentation is a positive step towards improving your situation. While it is true that ED does become more common as we age, it should not be thought of as an inevitable part of the aging process. Many men enjoy full sexual function well into their later years. It can range in severity among individuals. For some, it may be just inconsistent erections. For others, erections that are too soft to penetrate for intercourse. Others may experience early loss of erections, while still others may achieve no erection at all. It is difficult to know for certain just how common ED really is. It is estimated that 15 to 30 million American men suffer from ED. The chance of